Welcome to the Conversations That Count, July edition. My name is Angela James, and I work in community engagement at Lungevity Foundation. I'm so happy that you all made it to the Conversations That Count series today. The Longevity Conversations That Count series offers healthcare professionals, community health champions, and anyone interested in equitable access to healthcare an opportunity to stay informed, engage in critical discussions, and learn from top experts revolutionizing cancer care for all. Our series aims to deliver cutting edge insights on the evolving landscape of cancer, providing a platform to explore actionable strategies for bridging the gaps in lung cancer care. As a participant, you will gain access to knowledge that can shape the future of healthcare by improving outcomes for those individuals that's most in need. This month, we are joined by Jacquelyn E. Nixon, IASLC, PRA, a lung cancer survivor and president for Citizens for Radioactive Radon Reduction, also known as CR3. Jackie will discuss how she works with communities to highlight the dangers of living and breathing high levels of radon gas and its connection to lung cancer. During her presentation, Jackie will show how radon education bridges the gap between health, cancer care, and overall well being. Just a little bit more about Jacquelyn. In 2015, Jacquelyn was diagnosed with stage 1 lung cancer, and her subsequent investigation discovered high levels of radon in her condominium building. The revelation was a pivotal point to her joining Citizens for Radioactive Radon Reduction, also known as CR3, and creating the marketing the International Radon publication, CR3 News Magazine, to communicate about the cancer associated with radon. She's a 10-year lung cancer survivor due to early detection. She shared her experiences and knowledges of the danger of radon at the International Radon Symposium hosted by American Association of Radon Scientists and Technologies at regional EPA stakeholders meetings at LungCan and LungForce and so many others. She's presented at many webinars hosted by various lung cancer environmental organizations to help prevent future deaths and diagnosis of radon related lung cancer. She's a Hillman Cancer Center Community Advisory Board member. And in 2021, the International Association for the Study of Lung Cancer, also known as IASLC, selected Jackie Nixon as a participant for the supportive training for advocates on research and science, also known as the STARS program, as a patient resource advocate. Research advocate. Jackie wants us all to know that her entire well being is now dedicated to letting others know that simple solutions to good health are obtainable through research and education, and that there's always something we can do. You can learn more about CR3 at citizensforradonreduction.org. And with that said, I am going to give Miss Jacquelyn Nixon the floor.
Thank you so much, everybody, for joining us. And it's funny, when she was reading all that, the biggest pride I have is that I survived. I mean, that just stands out as everything for me. So everything else is secondary to me. So anyway, again, Jackie Nixon. And if, by the way, Mike, the contact information will be at the end of the slide. So if you have any questions and whatnot, I'm going to try to get through these slides, and then we can ask questions, talk back and forth, and then you could always email me as well, or call me if you like. So anyway, I am now the president of CR3 as of the first of the year, and one of my big things that I want to do this year as president is somehow change the narrative about radon gas. Radon is a very, very important subject. It's also a very dry subject if you promote it, if you're talking about it, because it's science, and you're talking to patients like myself who knew nothing about radon. So a little bit just to start about what I'm going to be able to do, or what I'm going to do. And let me advance this next slide, hopefully. There we go. And then one more. There we go. All right. Radon education, it plays a vital role in bridging that gap between, the health and cancer care and overall the well-being, it uncovers how an invisible environmental gas like that, directly contributes to serious public health issues and especially lung cancer. So how does radon education build this bridge? Basically, it connects the environmental exposure to health outcomes, right? Now, a little bit about myself. I was diagnosed in 2015, and I only went into the doctor's office super healthy, never had a cold, never got the flu. I never had the flu in my life. And when COVID came, I never got COVID. Still don't have COVID. So I was really lucky. No pneumonia, no nothing. I got one cold every 3 years, maybe, and it was usually a sinus little infection. It went away in 3 days.
Hey, Jackie, I'm not sure if your slide
Oh, you're not?
advanced.
All
You're
right.
still on the first one.
First one. All right, let me do this real quick. Stop share. And then, and please say, if you don't see the next slide, let me know. I can always do it
Okay.
again. And go down to here. There we go. All right. Can you see that?
Yes, we
All right.
do. I
That's
see the
where,
one that starts with radon education plays a vital role.
that's it. That's it. Now,
Okay. All
if
right.
each slide doesn't advance, just let me know and I can do that. Okay. So,
Okay.
all right. So again, super healthy, went into the doctor's office because I got shingles. Then while I was in there, and she said, "Yep, you've got shingles." And while I was in there, she says, "Well, because you're 67 at that time and you are on Medicare, you get to complain about 2 or 3 things every year, and they check it out, and it kind of starts your chart." Well, I was a little late in the chart because it wasn't until like May I went in or something like that. But anyway, I said, and she said, "If you got anything to complain about, let me know." And I said, "Nope, I'm good." So I said, "But I sing. And because I can sing and I can hold notes," I said, "the same songs I wasn't able to sing 6 months ago, and hold that note. I'm struggling, and I keep singing it over and over and I just can't get there." I said, "But now this is the number one thing I want you to learn. We who think we are so healthy think we know what is going on with our health." And I said, "But that's okay. That's just me. I'm sitting in front of a computer and long periods of time. I mean, like 12 hours a day, possibly." I said, "I just need to exercise my diaphragm." I know, right? So she said, "Well, are you coughing?" I said, "No." She checked my glands, she checked my chest. She said, "You're clear, you're clear, you're clear." And so at that last minute, and I will never forget, she had her hand on the doorknob and she was going to blow it off, and I was going to blow it off. I was playing with my phone at that point. And at the last minute, she had her hand on the doorknob, and she said, "Well, why don't we get a chest X-ray? Just you get something anyway, so let's just check it and make sure." I said, "Sure." I'm confident. I'm thinking, you're not going to find anything, right? Had the chest X-ray. 3 days after that, they called me and said, "We found something." And it was a tumor on the outside of the upper left lobe of my lung. I had to go in for a lobectomy, and they did all the tests. They verified it. There was no spread. Lobectomy, I was in the hospital for 3 days, and then I was sent home. Doctor said, "No chemo, no radiation, no medication, just walk, walk, walk." Okay. So that's what happened to me. I was blessed. So, needless to say, I went back after that to my first board meeting 7 months later. Now, let me go back 1 second. When you have all those tests, the PET scan, all those tests, and then you have the consult. I remember the doctor saying to me, he sat down, very first thing, the thoracic surgery, he said, "So, how do you think you got this?" And I'm thinking, I don't know. I'm thinking, you're the doctor, you're supposed to tell me, right? I've learned since then. It takes two people to dance, not one. So when I went back to this board meeting 7 months later, and I was talking to some people, I said, "Yeah, they don't seem to know why I got this." And every test I had, the blood test and the breathing test, I aced all those tests, the heart test, all of them. And so it sticks in your mind. Why did I get this? Why did I get this? So I was talking to this home inspector, and he said the magic words. Did you ever hear of radon? And I said, no, what's that? So he explained it to me, and I immediately got angry. And I immediately wanted to know, why hasn't somebody told me about this? So it will improve the exposure to health outcomes. Now, with that, I'm not advancing again. Oh, there we go. And that's what I was talking about. So the radon education raises awareness. If he hadn't said that to me, I wouldn't have known. So that's the number one thing. Number two, it integrates public health and cancer care, radon education. And by including radon testing and mitigation in cancer prevention strategies, radon education brings healthcare providers, the cancer care specialists, and public health professionals into a shared space of early detection and risk reduction. Like myself, it was only due to me getting in there because of shingles. Now, when the home inspector said to me, did you ever have radon? I took some of I call it cancer money, all right? And it was really the money you get from your insurance due to lost income. And I had the building tested. It came up high. It came up very high. One side was 18 picocuries, and the other side, Stanley, and it was done at the lowest levels. So I had the neighbors do it. I'm on the third floor. Stanley directly underneath me came out to 9 picocuries. When I turned it over to the condo association, they brought in a mitigator and they retest, which is what they do. And the other side of the building, Rose's apartment, came out to 21 picocuries. Stanley came out to 13. And I'll put that in perspective for you in a minute. So early detection is key. And that's the other thing. Now, the third thing is it empowers communities for health equity. When they did the testing, I was afraid because we're in a condo, we pay condo association dues. I'm thinking, oh God, we're going to end up having to pay for these mitigation systems. We didn't have to. Every condo association is different in every state. So, but it empowers communities who cannot afford this, and I'll talk about that in a minute. Low income and underserved communities often face the highest radon risks, and radon education helps to close that gap by promoting equitable access to testing resources and mitigation solutions, making environmental safety part of social justice. And then the fourth, promotes holistic well-being, of course. Safer homes creates healthier lives. Teaching families how to test and fix fix the radon supports physical safety, emotional peace of mind. I was literally whacked out when I found out about the high levels, and I'll tell you why. And it gives you a greater sense of control too over your whole situation. So, and let me know if you're not seeing this. I think you are.
We're not seeing slides.
All right, thank you. And so I'm going to stop and I will share again. I apologize for having to do this, but you're able to.
I thought I was seeing it on my end, so I thought everything was good.
Yeah,
Oh, that's interesting. Okay, can you see it? Can you all see it?
Yes, it's coming up now. It's on the slide that says number 3, number 4, number 5.
Yes, great.
Okay.
All right, those are the things I was talking about. And then lastly, strengthens health literacy and cross-sector collaboration. So, radon education enhances public understanding. All right. So those things are the key things we're going to talk about when it comes to this whole scenario. All right. Now, do you see the next slide? It should be a house.
yeah.
Yes.
All
Yes.
All right. I'm going to do this on every slide just to make sure.
Okay.
All right. I'm going to explain radon. Probably everyone understands this, that's on this particular series, but I want to make sure I do this. Radon, when it was explained to me, what I've learned, it is decayed uranium that is in the ground. It is everywhere. When you're outside, you're standing on it. When you're here, you're sitting in it. But the difference between radon gas affecting your lungs and the outside is when you're outside, the gas dissipates. It's a decayed uranium, turns into PM 2.5, and then that gas literally goes up into the air. So it doesn't affect you. But in your homes, you have your windows closed and your doors closed and whatnot. There are cracks in the building, and it could come in through those cracks in the building or your home. And if you've got like a crawl space, let me do this real quick. Construction joints where there's holes or areas around there, cracks in the inside walls, the sump pump hole or that opening. The gas can seep in through there. It can also go through cracks in the floors of the basement areas, and then of course, if it gets into the basement areas, that gas goes up. And if you've got cracks in the floors of the second floor, whatever, it's going to rise, of course. And so then it also gaps in service pipes, gaps in suspended floors, and private wells and groundwater supplies, those areas. So then that accumulates, but it's not something that's going to, of course, kill you over time. It's a slow process. And like I was in my apartment for 32 years at that time. And so breathing in that gas can affect your lungs and eventually cause lung cancer. Now we know radon is the second leading cause of lung cancer, and it's number one among never smokers like myself. I never smoked a day in my life. So I'm going to advance to the next slide. Let me know that you see it.
We see it.
Good. Is everyone seeing it? I assume yes.
Yes, I'm getting the
All
thumbs
right.
up.
All right. So high levels of radon. If you have radon in your home, the number one thing you're going to do is test for it. All right. And number one, there are two types of tests, and I want to explain these two types of tests. One, and you'll see where it says merchandise return label, that is a charcoal test, and it says alpha energy, but there are different ones. Different people make those tests. You can buy them at Home Depot, Lowe's. They're approximately $25. So you can get one of those tests right now, and you can hang it. And you hang it at the lowest level in your basement or very close to the ground, wherever, not on the outside, on the inside of your home. And it's a snapshot. You hang it for about 3 or 4 days, and then you put it into that mailer, you mail it in, and then the laboratory will send you the results back by mail or email. Okay. And so then you will just get a snapshot in those 4 days of what the reading was. Now, the other one, and the problem with that snapshot is this, first of all, when you do a snapshot, you're only getting that 4 days, and it might come out low because all the doors and windows are open at that point, if it's summer, depending. Now, we are in closed door conditions because of air conditioning right now. And that reading may not be an absolutely true reading. It's only at that point. So we also recommend that you look at continuous monitors. Now, the continuous monitor is the one that has a 0.91. I have 2 of them in this apartment right now in my condo. And the continuous monitor reads continually 24/7, 7 days a week forever. And they approximately, like, that's the Eco Blue, that's approximately $79. So they're a little bit more expensive, but the reason that we recommend them is because when you close your doors in the wintertime, the highest readings that we see are in the winter when the doors are closed and and don't have any air coming in, and you will see those readings change. All right. So if you do the short-term test, the little alpha energy charcoal test, and you do it in the summer right now, those readings may not be true. And I'll show you in a minute on a graph how that works. And so with the continuous monitor, that reads 24/7, 7 days a week, and it reads year after year after year. All right. I've had mine, I have one in here I've had for, that's got to be at least, I would say 8 years. And it was always reading at 0.3, 0.5, which is nothing. Okay. And then just in October of last year, I just happened to look down at it and it was at, it was like 2 point something. And I went, huh. So then I said, well, give it another hour. Let's see if it goes back down. And then I went back and it went to 3 point something, like 3.75. And then it started going up to like 4. And I said, what the heck's going on? So I actually had a Eco Blue that I had in a box because we use them for, shows and promo. I pulled a new one out. I put it in there and put it in my bedroom in a separate room. And it was going up to 4.75. Then it went to 5.75. Then I said, all right, I'm going to move it. Now, when the continuous monitor goes up, what happens is once it hits 4, it beeps at you. But you could turn that in the back, there's a button, but it beeps at you. So it was making me crazy. And so I turned off that thing. And then I moved it into where the pipe is on the side. The mitigation pipe is on the outside of the building. It's near my balcony. So I moved it into the living room. And it was going up to 5 point something. And it went up to 6.75. It went up as high as 7. And that's when I got a little nervous. I said, whoa. So I'll talk about that in a minute. So I called the mitigator and we had a conversation. We had 4 mitigation systems on this building. All right, I'll talk about that later. But what is a mitigation system? You see on the side, that house, that is the piping. And they will basically, the idea is that they shove a pipe underneath the building to the source. They have to find the source. So a mitigator comes in, tests, finds the source of that gas. Where's it coming from? Shoves a pipe basically to the source, and then they run a pipe from there on the side of the building, and then that little round thing is the fan. That fan then sucks that gas out from the source and then up the side of the building, which brings your level down to 4, or to 1, excuse me, down to 1. And that's the goal, is to bring it down to 1, which is acceptable. Now, just so you understand, the EPA guideline is 4 picocuries. It's not a safe level, but that's the guideline level. Anything above 4, you should really consider putting that mitigation system on. Okay. So, all right, let me see if I can advance. Now, understanding picocuries. All right. And this is where, when you say this to people and they don't understand all of this, you've got to be able to relay this information as an advocate to them in a way that they can clearly understand it's an issue. So I use this chart, and this chart was done by the U.S. Department of Health and Human Services in 1990. So, and it's old, but it's effective. All right. And of course, radon has been proven that it is a risk. It's a scientific proof. And so it's not something that's going to change. But what I do is, for example, I say with my building, which was 18 picocuries, I put it in perspective by saying 15 picocuries is approximately the equivalent of smoking a pack of cigarettes a day. If you are running at 7 picocuries, that's a half a pack of cigarettes a day, or 8, 16 cigarettes per day. I just use half a pack. They get it. And people go, oh my God. They can relate to something. So I like this particular chart because it does relay the, how critical it is that you improve your situation. So this is the one that I use and I like the most. Now, if you have high levels of radon, you need to get it fixed. And they're like, well, what do I do? Your first thing that you must do is you have to contact a mitigator. Now, that's actually a picture of my building, the mitigation system on the outside of the condo. And that's my apartment or my condo right there where that, I don't know if you can see my cursor or not, but where you see the vent. And that's me up there. But if you have to call a mitigator, it is very, very important that you use certified mitigators. The reason I say certified, they are certified in the state that you are in, and that they have actually done the exams and been approved by the state, and their name is listed on the state radon program as a certified mitigator that you can trust, knows what he's doing, knows how to put those mitigation systems on there. And that is critical. There have been some homes, and when I go to the Art Symposium, which we do every year, they always do this thing called Houses from Hell. And they look at these ones where these mitigations have been put on wrong, and they show you why they're incorrect and what the correction needed to be. So go to your state website. There are listings of people by zip code. You can type in your zip code and a list is given to you, and you can contact that person or that business in your area, and they can help you get it on properly. So that's for Pennsylvania. This is where the DEP is. The DEP is the EPA in Pennsylvania, and that's where we go to find ours. And again, if you have any questions after this presentation, I'll be glad to answer them. So now we know what radon is. We know what to do about it and whatnot, but what are the stumbling blocks to removing it? You know, we've got stumbling blocks, and these are the things you don't hear about. You hear test your home, fix your home. But there's things that you need to understand that go beyond that. All right. So in my experience as a survivor, these are the things that became, relative to me and that I became aware of. First of all, radon gas, the health perspective awareness. The general public is now trying to understand the science and the health risks, but these families, to these exposures and whatnot, but it's overwhelming. It was overwhelming to me when the doctor said to me, find out all you can about your type of lung cancer, which was adenocarcinoma. I didn't even know how to spell adenocarcinoma, and I went and I typed it in, and all this stuff came up, and I was like, oh my God, what is all this stuff? And I remember my first thought was, why can't all this stuff be in one place? And why do I have to research all this stuff? I'm the one that's dying. This is what I was thinking. So they're overwhelmed. And then radon-related lung cancer is rising quickly in public awareness as the second leading, cause of lung cancer. And then lung cancer caused by radon costs $2 billion in medical expenses and lost productivity each year. And so that's according to the World Population Review in 2021. So what are the risks? Environmental carcinogens, what is that? And then what's the cost of the disease? These are the things that we need to promote and let people know more about. And I'm not just talking about the patient. I'm talking about, of course, in healthcare and organizations and whatever. You need to understand the environmental risks more. So with that, I'll click. I think I'll click. There we go. Are you seeing the slides? I want to make sure.
Yes.
Very good. All right. The improved access to environmental data. What I am learning is that when it comes to radon gas, from a clinical standpoint, the problems tend to be that the data that has to do with radon that's being collected when you test your home, the labs have this data. And this data is not shared with the healthcare community and vice versa. The healthcare community can't access it, or, and what's going on, it's not correlated. There's no correlation. And there's reasons for that. It has to do with privacy laws and the way that the data is collected and what the patient or the homeowner will allow. So there's limited diagnosis. And that's one of the reasons, like my thoracic surgeon, he didn't know, that was in 2015, he didn't know about lung cancer, radon-related lung cancer, radon gas. Through my efforts, I gave him information and then he researched it. there's very few large environmental studies. I do know of a study going on in Canada right now with Dr. Aaron Godarzi, and he actually is getting huge amounts of funding in Canada, and he's backed by Health Canada to research the correlations between radon gas and lung cancer and finding biomarkers, and that's what's needed. And he's doing it through the collection of toenails. That's his recent one. And it's amazing. I went to Canada, I viewed his lab, and he's doing amazing things. There aren't a lot of clinical studies over periods of long periods of time. That's an issue. All right. The estimates of radon caused lung cancer, it varies. It varies all over the board. We need to work on data collection points. And so that means that we need to integrate as environmentalists with the healthcare field. All right. So with that, and of course, improve data through better collaboration. The environmental side, what I saw, needs to talk to the healthcare side and vice versa. So I wanted to relay this to you. Environmental data collection, we need more clinical tests. And then one solution, work with the physicians to gather info regarding environmental factors. And then nurse navigators provide info on how patients can test for radon. Environmental testers and mitigators share the results. Now, if you look at this, this is Pennsylvania. And I use Pennsylvania because I'm in Pennsylvania, but one of the things, first of all, the rate of the new lung cancer cases in Pennsylvania is 74 per 100,000 population among Black Americans, and significantly higher than the rate of 60 among Black Americans nationally, and significantly higher than the rate of 63 among whites in Pennsylvania. Now, Pennsylvania is the third state with the largest amounts of radon gas. The average home is testing in the red zones of approximately 40 picocuries per liter. Wow. Now, if you look at it, most of Pennsylvania is covered in red. Now, the second is zone 2, and that means there's an average reading that is less than that, but it is still high. And then the third zone, the yellow zone, if you notice, only one area, and that's in Philly area, is in yellow. That does not mean they're safe. That does not mean there are like maybe a few homes in certain areas that might be above 4. What they do is they take the readings and then they average them out. So Philly came out to be in the yellow average reading, but that red zone average, I'm in Allegheny County in the southwest area. Look at all the areas, the counties that are red zone. Look at the rest of the areas. Now, why is that? Number one, Pennsylvania is known for mining, known for it. We are also now known for oil and gas drilling, big time. Big time. And in the area of Washington County, Greensburg County, and there's some other southern counties, they found there were, and this was just in the last, I think it's like 6 years, a high level of Ewing sarcoma among children. And they were correlating it back to the oil and gas drilling. The state came in along and they did testing, massive testing, and came up with a report on that. So it also has to do with shale rock. Pennsylvania has a lot of shale rock, and that has to do a lot with the radon gas. But that's what Pennsylvania looks like. If you look at the national radon gas map, it will shock you. All right. So with that said, what I want you to see is fundamental radon challenges in the testing, in the correlation. What problems are we running into? First of all, number one, there's not enough public awareness about the radon danger. There just isn't. It should be all over TV. It should be a policy. In Pennsylvania, there is no policy that says you must test or you must mitigate. There's nothing that says, governmentally speaking, that says you have to do this. Now, we do work with the real estate, and they, upon sale, they are ordered, the radon testing. We hope that every one of them are doing that. So that helps with the awareness. But there's no law that says, because I found it, you have to fix it. What they do, though, is they try to include, if they find it, they include that into the sale, into the monies for the sale, and then they have the mitigation system maybe put on that way. But there's no law that says you have to do it. I can sell you right now a house full of radon, and the highest level of radon in the history of radon was found in Allentown, PA, and it was 17,000 picocuries, and it was in a $250,000 home. As a result, the EPA had to go in and test the entire area, which means all the homes around it and everything. The highest in the history of radon. But the house was sold and nobody had to actually fix it, according to the law. That's an issue.
Can you
So,
share about the new construction, what you were saying the other day?
yes, thank you. Now, one of the things too, I'm glad you added that. The new construction, one of the other things that has been done is that we now have, with new homes, they have what they call EPA new construction. So what they do is they build a home, and not everybody, but you can ask, do you have the radon new construction as part of this home that you're building? And what they do is they put in the piping for that home, and they don't put the fan on or anything, but it's set so that if the home is tested later on in life, or if you want to, you test and you find, and I did find somebody in Washington County that they did do a test and they came up high. They already had the piping in. All they had to do is call the mitigator back, and the mitigator puts on the fan, that round thing, and then set to start reading, and try, and then make sure it's reading and bringing that level down to 1. So new construction is now looking at adding that into it. So those are the awareness things. And ARS, the American Association of Radon Scientists and Technologists, are the ones that set those standards. And they are the ones that actually work with the construction to make sure that it is a ANSI standard. Okay. One of the other issues, crucial monitoring of radon levels in a fast and accurate manner over short period and long period of time. That's where I was talking to you about the long-term monitoring versus the snapshots. Those vary from winter to summer. The best time to test is in the winter because the doors are closed. You'll get a better reading. And then the last one, drive towards best, radon testing measurement and practices. And again, with the construction and statewide policies. Very, very, very important. Well, by the way, Pennsylvania is working on a law. We're praying by September that it will be passed. This is our 3rd attempt since 2019 that all schools will be tested for radon in the state of Pennsylvania. Right now in the United States, approximately 75% of the schools have never tested their school for radon. So you're talking about kids being in those buildings for 12 years, and they're on that ground. Some of those are the elementary, the middle school, and the high school are on the same ground. So it doesn't matter if they go to another building, they're still on the same ground. And we in Pennsylvania are trying to get a law passed that says all schools must be tested for radon. And if the levels are high, then they must be mitigated. We had to add in, because politicians said, and we do have bipartisan support, they said for us, find the money. We found the money, put it into the bill, and we are praying. We actually had a meeting with the governor's office as well, and they said, this should just be automatic. We should just add this, go ahead and pay for this and make sure it's done. So we're hoping this year it gets passed. This is our 3rd attempt. So with that, now, can you see this chart? Can everybody see the chart?
Yes.
Very good. All right. So this is how radon levels flux. And I want you to see this. This is for Colorado. Colorado has some of the highest in the United States as well. And in Jefferson County, zone 1, and in 3 days, they were consistently high levels, and during the nighttime periods that fluxed, and it went from 2 picocuries to 7 on a consistent basis. And then in Rio Grande County, which is zone 2, they tested for 2 weeks, and what they found in zone 2, that it was rising, it was fluxing from 1 picocurie to 42 picocuries on a regular basis. And of course, La Planta, 3 months, and the fluctuation for them, and this was done with continuous monitors, by the way, the EcoQ. And it was from 1.5 picocuries to 21 week by week. It's what it was doing. They tested all of these in the winter with closed door conditions. And then Boulder County, they tested for an entire year. And it went from 1 picocurie to 45, and it was continually fluxing. So you see now why I'm saying test in the winter. Continuous monitors are they're better because you can see over time, what your levels will be. We do want, if you want to get the continuous monitor, they do have them at Home Depot and whatnot, but we have them on our website. And if you go scroll down to the bottom, you'll see them there. And the EcoCube seems to do very well. I have no complaints. And it did spot that we were rising. So you can always get one. And it's approximately $79, $100, depending on what type you get. All right. Now, last thing, turning stumbling blocks into stepping stones. Yeah. We've got these stumbling blocks, but early detection is key. And this is what I want to talk about as a person that was spared due to early detection. Pathways to prevention. Now, when I was diagnosed, the first thing you do is you have to fill out that intake form of 300 pages. Did you smoke? Did your family smoke? Did you smoke? I mean, did your aunts and uncles smoke? Were you a part of the auto industry? All those things they asked you. As I was filling that, when I learned about the radon, which was 7 months later, but I back thought that, and I said, you know what? Nobody ever asked me about radon. What would it take? And I wrote a paper on this in 2019. And now it's starting to become a reality that, yeah, okay, maybe we should do this. But I said, what would it take to put one question on that form, just one, to start, that says, did you ever hear of radon? That's it. And so what I saw is that once you fill out this form, then someone said to me, well, the doctor can't explain it. Yeah, but what I saw was once I fill out the form, they sent me to, I guess it was the nurse navigator, and she had all the questions and answers and stuff on a screen. It goes into your report, and then she could see what I filled out and what the results of my tests were and all that. And she started telling me, here's what your journey is going to look like. You're going to have to do this, and we got to look at your insurance. She gave me some brochures on how to get rides to the hospital and, all these things. And I was sitting in her office. At that point, if she can see that whole thing on her screen and she sees that, oh, you don't know about radon, at that point, give me a brochure about radon. And at that point, she doesn't have to explain it. In the brochure, it explains it. And then if you need more information, you can contact whomever, CR3 or whomever, EPA, and they can talk to you further about the radon issue. They do not have to explain it. Now, what would that do? Capturing all radon test results and data points from medical history records, what would that accomplish? First of all, it would help contribute to a refined risk assessment for lung cancer beyond smokers and non-smokers. All right. It would also determine if personalized environmental reports, including carcinogen exposure such as radon, warrants a low-dose CT scan. If you're diagnosed with lung cancer, you're already going to get that. But if you can educate the physicians or whomever that you live in this high zone, maybe they can look at that and say, how long you live there? Oh, yeah, wow, 40 years, 50 years. You never did a radon test? And where do you live? Maybe we could justify it. If nothing else, it'll start pushing that needle, okay? And establish a national standard for knowledge management, for databases. It would, in changing the behavior of the general public, businesses and households would order a free radon test kit and use it. Why? Because the medical community and the healthcare community is recommending, maybe you should look into this radon issue. Potentially change the baseline behavior towards implications of radon exposure and radon mitigation, making sure public schools are checked, making sure information is included in the personal medical records of lung cancer risk assessment. Just a simple one-liner, checkbox. We could maybe make some change. All right, so in conclusion, environmental carcinogens are not normally included in studies by clinicians, of course. In fact, no lung cancer risk score predicting the incidence or mortality includes radon as a variable, not really. Further studies are needed to find out the molecular pathways of radon that cause lung cancer, and whether that radioactive gas is also involved in the development of the disease. And there is no clear need to increase awareness. There is a clear need to increase awareness among administrations, health professionals, general population. Now, over on the side is my CDC video I did. And I just want to point out, that's Dr. Maley. He's the one that's my thoracic surgeon. He is amazing. He's at the top of his class. I lucked out with getting the best doctors. And I do mean I lucked out because I didn't know what I was doing. And he was my surgeon. And we did this CDC commercial together. By the way, with respect to that, when I did we had the building tested and I got my readings back, I came in at 3 picocuries. So what I did when I had to go, I was getting those regular CT scans, you had to get them every 3 months. So I went in, and when I went in for the consult on that particular one, I gave him a copy of my radon readings. And he said to me, what do you want me to do with this? And I said, put it in my folder. That's all I said. So I had a second cancer, which was in the middle right bronchi. And it was there, and it had been there for 3.5 years. It never grew one iota. It was there when they looked at my upper left lobe and I had the surgery. So he found it, and I says, well, how did you miss it? He, being honest, that's why I love him so much. He said, we were so busy looking at the left side, we didn't see it. We just missed it. But it didn't grow one iota. They lasered it off in 2 sessions. I'm still stage 1A, no reoccurrences 10 years later. But what he said was, when they found it, he said, but this one, he said, it wasn't caused by radon. And I'm thinking to myself, oh, so you looked at that, that reading I got, and he checked it out. That's called forced action. That's what you can do. And that's what you can tell everyone to do. Take a copy of your radon readings and give it to your doctor. Whether you have lung cancer or not, just give it to your doctor and tell them, put it in my folder. And they got to do something with it, right? So that's what I wanted to relate to you. So with that, I think, and I did create this, that's the formula. And the formula was the function of early detection is greater than chemo, radiation, or medication. And that's what happened to me. So those are my conclusions. By including environmental studies, you're increasing awareness, You've increased detection of lung cancer. You've improved benchmark statistics. You've improved organization of statistical and user producer relationships, and improved quality, timeliness, and relevant of data. The adoption, what this is the most important, adoption of an international standard probably or hopefully for the detection knowledge management in relation to radon related cancer study goals. So with that, there's my formula again. The function of early detection is greater than the function of chemo, radiation, or medication. Those are my sources, and these slides are available for anybody that wants them, and I would be glad to do this presentation again. And that's my contact information. Test, fix, and save a life. Thanks so much. And if you have any questions, I'd be glad to answer them. I'll leave this up for a minute.
Thank you, Jackie. That was a stellar presentation. I know I learned a lot. We're opening the floor up for any questions you may have for Jackie. Feel free to jump right in or put it in the chat, whichever you're most comfortable.
I'm going to look in my chat. I think I can do that. Right. I'm going to stop share.
Okay.
Got this, I think.
Oh, right. I do see something in the chat. Okay. What quality of the second lung cancer found in the right lung was different from the left? How did the doctor know they were different?
That, my dear, is a good question. As a patient, he had a different name for the type. I forget it. I apologize. That's a good question. I need to know that. But it was the size of, it was like 1/4 of the size of the tumor they had on my left. And he had a name for it, which I'd never heard before. So I can't answer that well, but I'm going to get that answer for you. And Angela can send it to everybody.
Thank you.
Most definitely. I did put in the chat the National Radon Map and the CR3 website, as well as the directory of mitigators for the United States. Someone is asking, are you doing any advocacy for increasing access to lung cancer screening? Currently, it's only available for smokers over age 50, who's verified as a 20+ year pack per day habit.
For us, when it comes to the lung cancer screening, well, we work with all the organizations, of course. Now, one of the things about CR3, and I want to make this really clear, is if you are out there doing advocacy towards screening, then we are here to help you do what you do, right? What we do is we try to get policy passed. That's the most important. And then take that. And then we also try to work on educating healthcare field. But the big thing is we help to promote organizations like IASLC, Lungevity, LungCan, and whatever efforts you are doing, we are there to promote you. Now, how do we do that? We have the magazine. The magazine has been in existence since 2017, and we are now international. If you are doing anything in the lung cancer screening lens or anything, period, we want to put you in the magazine. We want articles that talk about what you're doing and how to contact you regarding that. Now, the other part of that, and it's not necessarily screening, we have the CLEAR network, but we want people to get involved with the CLEAR network. And that was through my own journey as well, which was, I was on the web searching for whatever I needed to know. We created the CLEAR platform for patients, organizations, environmental and healthcare, whatever, to go in there, and you can search for something that you need to know about by a keyword, and it will bring up every organization. For example, KRAS. And if I have KRAS gene, I can go in there and type KRAS, and KRAS kickers come up, longevity comes up, whomever. And I need to know more about lung cancer screening. Then your documents as an organization, that if you're involved in it, will come up, and it will advise the patient, go here, go there. I think that is better, that type of advocacy coming out of us. We're grassroots. And one of the things I've learned, if we create the same efforts that you are already doing, I think it just lessens the power of what we're trying to get done. So we support others. ALSI is working very closely with us, with the lung cancer screening. We support what they're doing any way we can. I hope that answers that.
Kathy is asking, could you share the name of the researcher in Canada again and briefly state what he's doing?
Yeah, his name is Dr. Aaron Goodarzi, and that's Goodarzi. And he runs the Evict Radon program through the University of Calgary. It's been around for a long, long, long time, but he is the #1 go-to when it comes to radon in Canada.
University of Calgary.
University of Calgary, and it's called Evict Radon. University of Calgary runs the program for him, but he's the lead on that program. What he does is he works, Health Canada supports him. And then I'm thinking of the other one in Saskatchewan. It'll hit me in a minute, but they Lungevity, they're very big too. And Lungevity supports them as well. They give him a lot of grant money to study radon and how it is impacting Canada residents, period. They are very different from the United States. When it comes to radon and how they have tied radon to Health Canada, which is the equivalent of American American Cancer Society. All right. They all work together for one cause in radon, and they support what Dr. Goodarzi is doing. Now, when it comes to his study, this new study, he's got many studies. You go to his website under Evict Radon, you'll see it. We put a lot in our magazine. Every magazine has articles and stuff by Dr. Goodarzi. And I did go to Canada, and it was amazing what they are doing. But his study, and I asked him, I said, how did you come up with this? And he said he came up with this new study based on some old results. And it was a correlation that had to do with radon and lung cancer. And he was talking to someone, and they said, since our feet are close to the ground, I wonder if you can absorb things from your feet anyway, right? You can get all kinds of things walking around with no shoes on or whatever. So they decided they were going to work on the correlation. Well, it turns out that correlation turned into a study. So they actually have people that come in, they're literally clipping their toenails, and they are looking at the toenails to see what's the level of radon, the radon reading from that. And so, and the other part is they built a new radon chamber. All right. There are radon chambers in the United States and whatnot. But this is a new type, and I can't explain it to you because I am not the scientist. But this new type does something different from all of the radon chambers that exist right now. And they're using that to find this correlation. So that's the best I can tell you about this. But there's information on his site, which is Evict Radon. And I think it's evictradon.ca. And that's how you find it.
Someone is asking, well, Gabriel is asking, what would be the best way for a school to test for radon? He's planning on giving some presentations to schools in his community on radon and would love to give them some options to test.
Excellent, excellent. Let me know if CR3 can help you with that in any way.
Which email would you like me to share, Jackie? Is it the one with the Yahoo or the one that ends?
Yeah, use the Yahoo one.
Yahoo.
We've been having a few email problems.
I'll put it in the chat.
Very good. First of all, when it comes to testing the schools, first of all, you're going to have to talk to your school administrator. We do know that. All right. That's where the buy-in comes in. The administrator, and then what we do is we train, not me, excuse me. There are people that train the administrators on how the testing will be done. Now, what happens when I'm giving a very, very non-scientific understanding of this, but what happens is that then when you get the mitigator comes in and they have to retest, and they test every so many classrooms. I think it's every fifth classroom. And then they usually like to do the test when the kids are in school, which is odd to me because the doors are open and da da da. But I was told that's what they like to do. And then once they do these tests, then that's when they determine, okay, what are the levels and where are the, and if the level's high, where the source is coming from, and then what the mitigation system would be. Now, the other thing with that is that they also look at the air conditioning system. Sometimes, depending on the schools or the home, sometimes it could just be an air conditioning adjustment, is what I was told. But I don't know under what conditions that would be the case. And that's with any building. You just might be able to adjust the air conditioning, and because of that flow, it reduces that reading. So that's the procedure, but you really have to get the administrator, the buy-in from the school administrators. Hope that helps. Let us know how we can help.
Anne is asking, is there a radon brochure to leave at a cancer center?
Say it again. I didn't hear the last part.
Is there a radon brochure to leave at a cancer center?
We have brochures absolutely that you can leave there, and absolutely we can get some ordered for you and sent to you, or you could actually order a few yourself too, because we don't have a big kitty, but we can send you some. Yes, you can leave those. I've actually left them at the Hillman Cancer Center, and it's just an overview that talks about what is radon, why you should test, where you can go. And also it was on my slide, but bottom line, if you don't know where to go when it comes to your EPA or your radon organization in your state, you can go to 1-800, didn't I have it up there? 1-800. Oh my God, it's gone. It'll come to me in a minute. But there's an 800 number, and I will get that for you. I think it's on my slide, as a matter of fact. So you can go there, and then that's through the University, Kansas State, and then they will direct you to your state radon program.
Foster is asking, why does it take so long to change policy? Who's in charge? Speaking of policies on getting radon added to the questionnaire, getting people into treatment more quickly from a suspicious CT, etc., that type of thing.
First of all, as far as policy is concerned, everybody is concerned about the cost. The average radon mitigation system on a home is approximately $1,200. It's approximately 12. It depends on what state you're in and where they find the source and how many sources. We have 4 on this building, so each one say about 1,200 or so to 2,500. So when you're talking about schools, the first thing we were told was find the money. They said, you have a better chance of passing policy if you can tell us where we have this money that we can spend. And we found it. Now, where we found it in the beginning was pre-COVID money that they had. And then they were putting on those, the detectors in schools to detect, metal detectors and for the, gun safety and all that stuff. In there, they had money for environmental stuff. And we found it in there. But since then, we found it somewhere else, and I have to look at the policy again. And that is available to you too, as well. So it was about the money. Now, the other part of that is this. When we talk to the schools and whatnot, and the administrators were not all, oh yeah, we're going to do this. They were like, okay, should we do this? And the reason being that if you test, and you find out those levels are high, their worry is, and then they have to be disclosed to the parents. If the parents find out, will they sue? Will they become litigious? So they kind of like, okay. And then it's left. So that's an issue too. But the schools are starting to understand that long term, the kids are the most important. And that's what, as an advocate, that's what you've got to push. The children are the issue. The children have got to, have early detection. So that's a big issue right there. And you've got to solve those problems. Did I answer the full question?
Well, what about in like a doctor's office? Like you were talking about getting, on a pamphlet, like why is it so hard in the medical world to get it done?
Well, I just think, well, the doctors, they don't have time to explain it, first of all. Okay. They just they don't understand it well enough to explain it. And I don't really think that should be their business. But the problem is that, first of all, the brochures, it's just a matter of getting enough money to make sure that every hospital, every doctor's office, or every organization gets those brochures and gets them into the doctor's offices, the medical facilities, the clinics, and all of that stuff. Again, comes down to money, doesn't it? Right? But when it comes to explaining it, I think that should be all of us, our responsibility. The doctor should be able to offshoot it. Now they'll say, there was a doctor, I went to a meeting and she was there and she's talking about all of these issues when it comes to lung cancer. And I said, what about the environmental issues? Now, I'm the only environmentalist in the room. And she said, that's the state environmental department's responsibility. But it isn't. It's your responsibility too. But if you don't know about it, what do? We pass it off. We got to get better at understanding this and then how to promote it. And that's a problem. The promotion is a problem. So I'm looking at different ways to get the word out. You should look at it, the website, your website. That's another thing. Having it on the website saying 21 people die every year, 21 people die. They're not listening. Are they on your website even reading this? You have to get out into the community and start promoting it. One other thing I want to mention to you, I want to make sure, and we could do that as an offshoot. We established a nationwide radon library lending program where any library can participate. And we focused on Pennsylvania to start, but it's for any library in any state that you can contact us. We'll get you set up. The library will start with 3, 4 continuous monitors, whatever they want to purchase. And then the people in their community can check out the continuous monitor, go read their home, and then after like 10 days, 15 days, bring it back, and somebody else can check it out. They will at least know their numbers. Now, that's still a problem because I'm going to tell you right now, there's no money statewide, and the national money is already allocated, to be honest with you, to fix the high levels of radon. It's on the homeowner and it's not covered in your homeowner's insurance. So we're working towards that. We're trying to get the insurance companies to add it to homeowners insurance. That isn't there yet. So we are also working to try, CR3, to try to create a fund that is for low income, people who can't afford it. They can apply and possibly get $1,200 to get it on their home, elderly, that type of thing. But right now, there's nothing. There is a surge grant, that's the government grant. It was held up, but it's now been released as of last week, I found out. But it's also been reduced. So unfortunately, it was only like $10 million and they reduced it. That money's divvied out among the EPA regions, and there's about 8 regions in the United States. And then so they're going to get the money, but HUD already passed a guideline that says, all HUD properties will be tested, and if it comes up high, they must be mitigated. And the renters have the right to test, and the landlord cannot give them flack about it. They'll have to fix it. So that money is going to go towards that HUD guideline for next year. They got the money from last year and they're working on this, but most of that money is going to go towards that situation. So we have got to do more on our own.
It does sound like getting to the parents and like local community, like you're saying, like on a Facebook page, and getting them aware of it for them to put pressure would be a really good idea. I don't know if firehouses, you know, can be involved. It seems like the public library seems like a great way to get in and educate, you know, smaller towns.
Yes, absolutely, absolutely. The PTA, like if you can get brochures in things like the PTA, get them educated. One very big school nurses, the school nurse associations, you know, or whatever, you have state association. If you can get by, and I'll guarantee you that if they were educated and they would buy in. Absolutely. We have school nurses, and we've got people that are teachers that have passed away from radon related lung cancer. Ohio, our founder, she's a teacher, but her husband was the one that passed away, but she was very big on getting the teachers involved. So we try to work with the teachers, but you know, that's vast. We need more people. CR3 needs more members or organization that become members. Then we go out there as a collective and start pushing this out. We can, you know, supply the needs, you know, the brochures and the events, and we can create things together to make a stronger outreach. But yes, you're very right on that. So anyone you can get. And another one is the asthma. What is it? The American Asthma, you know, Association. That would be very good too in your local communities.
We do have someone here, Jackie, Mike Hewley. He says he's working with a radiation mitigation company on an advertising campaign to encourage homeowners to test, and they'll provide the test at no cost. But they're focusing their efforts in Philadelphia, Milwaukee, and where else? Oh, Minneapolis and mid-Michigan first. So I thought Philadelphia might jump out.
Yes, very much. We can. Now we have here in Pennsylvania, we have the Pennsylvania Radon Health Equity Work Group, and it was established by the Pennsylvania Department of Health Equity. They asked us to start it. We've been in existence for 2 years, and our focus is to do this. And part of what we're doing, CR3 works with them and we're trying to get this fund going. So if we can work together and get it in, and we're doing the library lending program across the state. We're working with the cancer centers. And then we're working with 2 libraries in Philly, 2 libraries in Harrisburg, and 2 libraries in Pittsburgh. And then we want the school libraries. We're working with school libraries. So working together would help get that going. Anything that we can do to work with you, if you'd like to work with us, I'd be glad to talk to you about it.
Okay. Well, we are. Oh, wait, somebody just put something else in. Oh, Mike says thank you.
Oh, you're welcome.
We're
Hey,
on
Mike,
time.
baby.
We're a little bit over time, but we thank you so much, Jackie. I put your contact information in the chat, and everyone here will receive your slides, everyone who registered. So thank you, everyone, for coming, and thank you, Jackie, for your great presentation. We appreciate you.
Thank you so much, guys. I really appreciate all of you. Anything
Until
you
the
need,
next
let me
time.
know. Bye-bye.
All right. Bye-bye.